Guys, this is Preeti and you're watching my dissolution. In this video, I'll be teaching you structures undercovering deltoid muscle, which is a 5-mark important question for the university exam, and you had to remember till your final exam. Once you read and then read through the images, seeing images, you never forget. You had to remember till your final exam also for by the way to get marks. So the bones will be the structures will be like a bones under the deltoid muscle will be the head of the humerus and the coracoid process. This is a head of the humerus. This is a humerus bone. This is a head of humerus, and here anterior on the anterior aspect you will be having coracoid process. So I hope you remember the bones, and the joints and ligaments will be. As I already said, deltoid covers the shoulder joint like this in a curved manner. So shoulder joint is also known as glenohumeral joint. You know this is a glenoid cavity and this is a humerus. So ligament from here to here, glenohumeral ligament or joint. If it is a ligament, shoulder joint is also known as glenohumeral joint, and coracoacromial ligament. Here will be the, I said, anterior side will be the coracoid process, and this is acromial process. From coracoid process to the acromial process, coracoacromial ligament. And bursas which are under the shoulder joint will be subscapular bursa, as in sub means below the scapula, in the below the deltoid. No, deltoid will be anterior fibers also will be there. So posterior fibers is also there. In the posterior fibers arises from the scapula. So below the scapula one bursa is there. So scapular bursa. Below the scapula, no. So subscapular bursa, as you can see here. This is a subscapularis. This is the subscapular bursa, below the scapularis muscle. Below the sub means below, scapular bursa. Below the scapularis muscle is there, so subscapular bursa. And other two bursas will be subscapular bursa, subacromial or deltoid bursa. And this is below the acromial process. This is subacromial bursa, and this is also below the deltoid muscle. So subdeltoid bursa or subacromial bursa. And one more bursa will be sub-infraspinatus bursa, below the infraspinatus muscle. So three bursas are there: subscapular bursa, subacromial bursa or subdeltoid bursa, sub-infraspinous bursa. The three bursas will be subscapular bursa, subacromial bursa or subdeltoid bursa, infraspinatus bursa. And bursas are done, bones are done. Bones, head of the humerus, and the glenoid head of the humerus and the coracoid process will be the bones. Ligaments will be shoulder joint. Shoulder joint is also known as glenohumeral joint, and coracoacromial ligament. Ligaments and joints are done, and bursas will be below the subscapularis muscle, subscapular bursa, below the acromial process, acromial bursa or subdeltoid bursa, subacromial or subdeltoid bursa, below the infraspinatus muscle, subinfraspinatus bursa. All this will be covered by the deltoid muscle. This entire thing is a deltoid muscle. And origin and insertion of many muscles like long head and short head of biceps, which are the muscles of the anterior compartment of the arm, and long and lateral head of the triceps, but medial head will be deeper than these two, and coracobrachialis, which arises from the tip of the coracoid process, as I already discussed in other videos. And insertion of pectoralis minor, major, and latissimus dorsa, which is a back muscle, teres minor, supraspinatus and infraspinatus. You can see in this image, it provides insertion for supraspinatus, infraspinatus, teres minor. Here will be the deltoid muscle, and latissimus dorsa in between the groove in the anterior aspect, in between the groove, latissimus dorsa will be there. In between the bicipital, there is a bicipital groove in between the greater tubercle and lesser tubercle. There, this latissimus dorsa will be inserted. Pectoralis minor muscle, which is inserted into the medial border of the coracoid process. Pectoralis major muscle. And then pectoralis major muscle takes origin in the clavicular head and then into the sternal head. And this will be the origin and insertion of the muscles which will be below the deltoid muscle. And vessels will be anterior and posterior circumflex humeral artery, as you can see here. These are vessels, anterior and posterior circumflex humeral vessels. So this will be also below the deltoid muscle. Deltoid muscle will be like this. So anterior and posterior. Anterior will be front. Posterior only they have mentioned. Posterior circumflex humeral artery and vein. And axillary nerve. Now will be axillary nerve. Vessels, anterior posterior humeral vein or arteries or vein, as anterior now will be axillary nerve. Spaces will be quadrangular spaces and triangular spaces. These are the spaces. Spaces means gaps where there is no muscle. This is a upper triangular, this is lower triangular, and this is quadrangular. Two triangular space, upper and lower, and this is a quadrangular space. These are the structures undercovering the deltoid muscle. Once again I'll revise. Bones will be upper end of the humerus and coracoid process. Upper end of the, this is the upper end of the humerus, and this is a coracoid process. Bones you are done. Ligaments or joints, ligaments and joints to show you a image. This is a shoulder joint, as you know, so below the shoulder joint will be the shoulder joint is also known as a glenohumeral joint, from glenoid cavity to the humeral cavity, and coracoacromial ligament, which will be present in between the two processes of the scapula. And the bursas will be below the subscapularis muscle, subscapular bursa, below the acromial process, subacromial, or below the, it is also below the deltoid muscle, so subdeltoid muscle, below the infraspinatus muscle, the infraspinatus muscle. And muscles origin and insertion will be to remember, like long and short head of biceps, which is present in the anterior compartment of the arm, and coracobrachialis, and lateral head of long and lateral head of triceps. The medial head will be deeper to these muscles. Then insertion will be pectoralis minor, major, latissimus dorsi. Insertion, it provides for pectoralis minor, major, latissimus dorsi, supraspinatus and infraspinatus muscle. You can see here supraspinatus, infraspinatus, pectoralis major and minor will be in the anterior compartment. So yeah, it covers in the anterior compartment as well. So, and anterior circumflex vessels will be anterior and posterior circumflex humeral vessels. Anterior and anteriorly will be the, it is not seen here, as it is a posterior view, posterior circumflex humeral artery, and the axillary nerve will be the nerve. And the spaces will be three spaces, one quadrangular space, upper triangular space, and lower triangular space. These are the structures under covering deltoid muscle. Thank you.